Welcome to the Hand to Shoulder Solution, giving pain the middle finger. I'm Petitto. I'm an occupational therapist and a board certified hand therapist. I've been practicing since 2000. So what is a hand therapist? A hand therapist is an occupational therapist or a physical therapist who's been practicing for at least 3 years and has a minimum of 4,000 hours of experience evaluating and treating orthopedic conditions of the hand through the shoulder. At that point, the therapist is eligible to take a board certification examination. And after successfully passing the examination, they can use the credential of a hand therapist. We're supported by the ASHT, American Society of Hand Therapists, and we're governed by the HTCC, Hand Therapy Certification Commission. So what do hand therapists do? So hand therapists evaluate and treat orthopedic conditions that affect the fingers to the shoulder. So if a person is having pain from maybe they strained a tendon, which connects muscle to bone, or they overstretch the muscle, or they have some sort of trauma where they sustain a fracture or a break to a bone, or tore a ligament which connects bone to bone. If a person needs surgery, and after surgery we need to control scar tissue so it doesn't stick to underlying surfaces, we need to make sure the healing fracture or bone break does not shift so it can heal in proper alignment. With that, we fabricate custom orthotics or custom splints to stabilize a fracture, to allow tissues to heal. So basically, any condition that affects the bones, the tendons, the muscles, the ligaments, the nerves, any of the structures, any of the mechanics of the body, specifically from the fingertips through the shoulder, that's what the hand therapist deals with. My experience is primarily hospital outpatient departments, and I spent most of my career in private practice. I currently practice within an orthopedic department with a hand surgeon, general orthopedist, as well as physician assistants. That's a great environment because we can collaborate in real time. The surgeon will grab me and say, "Hey, Carl, you just repaired a tendon. The nerve was severed too. Repaired the nerve. I used this technique so the repair is nice and strong." And then I know in the back of my mind that maybe I can use a more aggressive treatment approach. Or if the surgeon's repair is more tenuous, for example, tenuous meaning, fragile or weak, then I need to slow things down. Really the gold standard that we use as therapists and physicians specializing in hand therapy is the protocols from the Indiana Hand Center. Those protocols are really the gold standard when it comes to evidence-based practice, best practices, which we'll talk about later. What are best practices? How do we stay current in the field with advancements that have been made? That's very, very important for hand therapists and hand surgeons in any professional practicing in a hand surgery, hand therapy environment. Now, what is a hand surgeon? I've mentioned that I work closely with hand surgeons. So a hand surgeon is a physician who first becomes an orthopedic surgeon. Orthopedics, they work with all of the structure of the body. So the bones, the ligaments that connect bone to bone, the tendons that connect muscle to bone, the muscles themselves, the nerves that allow us to have sensation and allow us to have motor control, the nerves that send electrical signals to our muscles that cause them to contract. Now that's a general orthopedic surgeon. A hand surgeon goes on to further training, typically a fellowship in hand surgery where they're mentored and they get a significant amount of training to to further their expertise in that specialty. You know, I like to use the analogy of a physician who becomes a cardiologist. The hand surgeon is a physician who becomes an orthopedic surgeon, then becomes a hand surgeon. The hand surgeon specifically usually really focus their practice on the hand and the wrist, the fingers, the hand, and the wrist. Hand therapist is pretty much the fingertips through the shoulder. The hand surgeons, work for the whole upper extremity, of course. So there's, some little nuances there. So I mentioned current. So staying current with advances made in the field is very, very important. In any industry, I have a background of welding and machining when I was in the Navy. Look at the advancements made there with a lot of the trades. What we do is we go to what's called continuing education, CME, continuing medical education, or where we get continuing education units or CEUs. And I go to two really main meetings, we call them, because the surgeons and the therapists meet. There's usually a few hundred people there, and it's really a great venue for presentations, lecture with amazing PowerPoints, and the surgeons will get up and mention their latest techniques that they have learned that are most optimal for less trauma to the patient, a quicker recovery time. And then the therapist will get up and talk after the surgeon and say, these are the latest research studies that have proven, these therapeutic techniques with these tools and these methods and these procedures afford us the opportunity to really get the patient better quicker, and moreover have a better outcome, an optimal outcome. So it's a meeting where the surgeons and the therapists can present very nicely and talk one-on-one as well. And then there's what's called breakout sessions, where we can break out into specific areas where, if for example, if I need to, learn something more about how to optimally rehab a nerve repair. So here's a common thing that happens to a lot of people. They're holding a package of frozen hot dogs, and they have a sharp knife, and they're trying to separate those hot dogs, and it slips, and they cut the tendon in their one or both tendons of the finger that bend the fingers that's connected to the muscles of the forearm. The tendons travel through the carpal tunnel. We'll talk about all this later. I want to really lay out the mechanics of things. And they also get the nerve. Well, it is. Did the surgeon have to do a nerve graft, or was the nerve severed in a way that they can just do a microsurgery and sew it together end to end? Did they use a conduit so that it really guides the nerve regeneration optimally, so it communicates very well with it? What are the latest protocols? So there's breakout sessions where we can really dive deeper into it. I went to an excellent one with the shoulder, manual techniques, joint mobilization, traction mobilization, soft tissue work, where we can work on each other and practice these techniques on each other in class. So that might be, a couple of breakout sessions a day. So that's the that occurs in Philadelphia, and it's a surgery and rehabilitation of the hand and upper extremity is the name of the conference or the meeting. It's put on by the Hand Rehabilitation Foundation. Now, another meeting which is very, I feel that it's very important to attend, that I attend annually, is the ASSH, American Society for Surgery of the Hand. So that's primarily attended by surgeons. So I like to go there and really learn what are the latest surgery techniques that are being performed. So it's my duty to know that. So as a hand therapist, rehabilitating patients after hand surgery or any surgery in the upper extremity, you know, what is the technique? I need to have a good familiarization. And on top of it, I always read before I take the patient back in the clinic, read the operative report. What, as clinicians, everything we do after we see the patient, whether it's a surgery or therapy or whatever it is, an injection, we document every little detail. So what is the patient's main complaint? What was our findings? What did we do in treatment? It's all documented. So I can look at the surgeon's notes and say, oh, okay, he used that technique. That bone was removed. It was replaced with this. There was a graft that was done, or soft tissue, et cetera. So the details matter. It doesn't matter what you're doing, whether you're building a ship, building a model of a ship, you're welding, you're machining, you're building an aircraft. Success is in the details. So we really have to know the details, and being caught up on the most optimal techniques, and understanding what the research shows is optimal, because there's a lot of things that work. So no matter what we're talking about, if there's a lot of things that work, what's the best thing? So I know that if I'm a patient somewhere, whether a physician, my physician is clearing up bronchitis or a sinus infection, I want the best treatment, and I want to give my best treatment to my patients with the goal of a perfect outcome, and get to that perfect outcome as soon as possible. Another thing I enjoy is mentoring colleagues, so occupational and physical therapists who want to become a certified hand therapist. They'll come into the office as shadow and learn, and then also remote remote training where I'll get a call. Hey, I have this case. I still call my mentors. I talk to the surgeons. What do you think about this? This is going on. It is somebody to bounce things off of. It's a lot of problem solving. Everyone is different. There's a lot of nuances. If I have a surgery in my right hand and wow, that went great, and then everything went smoothly, and then I have the same surgery in my left hand and wrist, that might go totally different. You might need a different type of external stabilization with a different brace. I might need to rest a little bit longer on my other side before I start moving, or I might need to start moving it sooner. So there's significant differences within the same person. There's also significant differences, of course, amongst different people, and that's where the word practice comes in. So why do we call it practice? Some people are probably think, well, I don't want you to practice on me. I want the real thing. We call it practice because practice is a blend of science and art. So the science is what I was just talking about. All of the, the research studies. Are we doing best practices? Are we current in the field? That's the science. In the sciences, things like the inflammatory phase of wound healing is 10 to 14 days. A week or two, depending on the person. Now the art is we have this toolbox of tools: ultrasound, cold laser, soft tissue tools, traction, which is separating the joint, mobilization of joints, thermal modalities or treatments, electrical stimulation. The list goes on and on and on. So because each person is different, you can have 5 people lined up exactly the same issue, but all those 5 people are going to respond differently. So what tools you use, in addition to the combination of how you use the tools and when you use the tools, that's the art. It's a ball of wax that is always moving, and you're always reassessing the patient. So that's the art. So it's a blend of science and art. So call it practice. All right. Now, this podcast, I'm bringing this to you because I want you to understand the fundamentals of your body. It's really important. It's very important to me when I'm sitting one-on-one with a patient. Number one, that they understand what is causing their pain. Number two, if they're coming to me and they're getting treatment without surgery, which that's always the ideal. Surgery is always the last resort. So most of the time, I help people avoid the need for surgery. So I'm educating the patient. Okay, here's what's going on. Here's what I recommend we do, and why. And when patients understand the why, that's when we obtain optimal patient compliance. Compliance or participation with their own care. So what's most important with therapy is that patients perform in adequate, very targeted, not broad, not huge, not time-consuming home program. So when the patient is at home, I want them doing whatever they can do for themselves most optimally to really facilitate or just speed along their recovery. When they come into the office, which most conditions, if it's a very serious condition, I have to watch it or follow it really closely 2 to 3 times a week. Most conditions are, once a week, with relying more on a home program. Tennis elbow, which we'll talk about later, I'll follow up with patients once every 7 to 10 days. And then sometimes I move them out to every 2 weeks while they advance their home program. And there's a lot of nuances there, which we'll talk about later in some other episodes. But I want the patients to, understand the what and the why. And I want you to understand this so that you can obtain what exactly you need when you need it. In healthcare, taking care of your body, or really taking care of most things, your car, you start hearing a click or the engine is sputtering or something's going on. The longer you let it go, most things, the worse it gets. I think we can all agree on that. So timing, especially with the very unforgiving nature of the fingertips or the shoulder, timing is absolutely crucial with nearly everything. Now, it's very important that you understand that this is not treatment or advice. I really have to have someone in the office to really adequately, effectively assess what is going on in order to give good advice. This information sharing is so that you may be empowered to make decisions for yourself in accordance with your healthcare practitioner.